Hello, everybody. Welcome to this METHEVAL seminar. We're very happy to welcome today Sarah Van Bell and Bruno Marchal from the Institute of Tropical Medicine at Antwerp for a presentation entitled Theory Building in Global Health, How Realist Evaluation Considers the Role of Context. So Sarah specializes in public health. She has more than 20 years of experience working in research and program management related to health governance and sexual and reproductive health and rights in low and middle income countries. She's an expert in realist evaluation. And Bruno is a professor and head of the Complexity and Health Unit at the Institute of Tropical Medicine. He specializes in urban health systems, health system adaptation to climate change and resilience, and research methodologies for complex issues in health, including realist evaluation. So Sarah, Bruno, I will now leave the floor to you for a presentation of about 40 minutes, which should leave us about 20 minutes for the discussion, and participants can send their comments and questions in the chat throughout, and we'll have a Q&A after your presentation. Thank you so much.
Thank you very much, and welcome everyone on this sunny late afternoon. Thank you for joining us. I see some familiar faces, and there are also not so familiar faces. Welcome, everyone. We didn't know how diverse the audience would be today, so we're going to start off with something what is considered the golden standard in global health. Wait, I'll try to change my... And that is the quasi-experimental design, of course, which in global health has for a long time been the most important format for impact evaluation. But let's say, or our argument is a bit today, that we've been in the last 20 years taking a U-turn. Of course, the influence is still, and a lot of you might still argue that it's still the golden standard, because we have this evidence-based medicine paradigm in global health. And next to that, also, there's a success of the evaluations of the MIT Poverty Action Lab, who did, or who do still do, a lot of randomized controlled trials on social policy programs, crime prevention, agriculture education, and we also recently even won the Nobel Prize with Esther Duflo and Abhijit Banerjee. But we'll argue that we're sort of making a U-turn, a slow U-turn, where the complexity perspective has entered global health, entered the fray after, of course, the social sciences. And we see that an institution with renown like the Medical Research Council has recognized that there is something like complex interventions, and has published a number of guidances on how to evaluate complex interventions. And also DFID, following that in 2012, published a report on the need to broaden impact evaluation designs. And this then goes for the development programs they were supporting. Now, very important in global health was also, or is still, Professor Trisha Greenhawk of Oxford University. She is a professor of primary healthcare there, but she has for a long time been arguing, let's say, for a reform of the evidence-based medicine, and she calls it also the evidence-based movement. And she has recently also with COVID, with all its uncertainty and its adaptation of protocols and the like, asked in, I think it was British Medical Journal or the Lancet, is COVID now finally the nemesis of evidence-based medicine? Now, this turn towards complexity in global health does not come from anywhere, but it comes from social sciences. So the social sciences, and notably, some of you know him even, I think, David Byrne. David Byrne of Durham University is now an emeritus professor in sociology, has already said a long time ago that RCTs are perfectly fine when you deal with simplicity, when there is one cause to one effect, but that they're valueless if we are looking at patterns of complex causation, such as multiple causes to one effect, or indirect effects, or a causal chain. And there you have to establish not just what works or looking at effectiveness, but you have to look at what works in specific spatial and temporal contexts, what works when and where. And there we see that context, or the issue of context, and I would say that it goes for a lot of disciplines, is getting increasingly more room for discussion. And Paulson, Ray Paulson, the forerunner of realist evaluation, said in a YouTube interview in 2013 that he considers the role of context and how we should manage that one of the great learnings in evaluation. And he refers in the same interview to the idea that it used to be the case, maybe a bit put strongly by him, that help programs used to be referred to as treatments, or treatments that were administered to people, but it's kind of true, because there was no regard for the relational dynamics if you look at health programs, or there was little understanding of the influence of context, or in this case, health systems in programs. This attention for the influence of context is gradually building up, I think, from the 2000s. If you look at or do a simple search on PubMed, you see this slowly growing. And there have been a number of very important articles to look at how context influences program impact and how to ensure external validity. And this is in sync with a general turn, we think, towards considering what robust causal explanation means in different sciences, what causality is in different disciplines, and also the need for better theorizing. And I'm mentioning this with Swetberg, who is an analytical sociologist, but not a realist. And I even would argue that there are current flashpoints that make it even more important, namely the strive towards implementation science in health, the climate change and its focus on solutions being adapted to the context, artificial intelligence and its problems with grappling with context, and also the decolonization of science. And realist in evaluation sort of enters this realm, or this ambience or atmosphere of looking at context and causal explanation. It's part of the theory-driven evaluation school, which has been initiated by Chen and Rossi, in the 90s. And other sort of simpler version is a theory of change. And the idea of realist evaluation, and a lot of you know that, of course, is a focus on program theory and generative causality predicated on mechanisms or social mechanisms. And in recently guidance on complex interventions, you find realist evaluation also as being mentioned by the Medical Research Council. The rationale, very briefly, on realist evaluation, its rationale is that in its essence, global health programs are not so much about the treatment, but much more they're about social programs and relationships between people. People are the ones that make programs work. And this also means that programs succeed in some places and in others they fail. Yeah.
All right, I'll take over from here. So what we'll do is we'll split this presentation, in fact, in 4 parts to avoid that you will fall asleep. So I mean, most of you, in fact, attending this seminar and probably others as well in the series are quite well aware that context plays an important role in the whole realist approach. The book of which you see the cover here in the right-hand corner. That's where Ray Paulson also situates, in fact, the realist approach within systems thinking and complexity. And so, from a realist perspective, all programs that you will be looking at when you do evaluations will be open systems, and they kind of interact, or are situated in other systems. And so there's this notion of embeddedness, which is an essential characteristic of systems thinking. Now, we also know that realists will look at the way particular interventions obtain their results or not by triggering mechanisms within specific contexts. And so that's the kind of the essence of the context mechanism outcome configuration. This is kind of related to thinking in realism in general. And we just put on the right-hand side here a box to kind of remind you that other people, of course, have written on realism as well. And the book by Sayre from 1992 is quite interesting. Now, what does context mean in terms of realist evaluation? It does not mean specific place, a geographical area, or a locality. It is much more than that, of course. And we often kind of say in courses here that context is everything that is not the program you're looking at. So when you do evaluations or when you do research on particular situations, anything that is not the exact topic of your research will be part of the context. That means that it's not bad to look at it as a kind of an onion with multiple levels and multiple layers. And you see that okay, there are multiple ways, again, to look at these multiple layers, multiple terms, but there's the individual aspect of it. There's a kind of one-to-one dyadic relationships, but also relationships in groups of people or in families, in teams. There's the organizational culture or an organizational layer of context, institutions, cultural systems, and in fact, the kind of macro level social structures. An important aspect of context is also that, of course, context is dynamic, and we'll see that that will have consequences for the way we do evaluations, and it actually is quite a challenge in a lot of the evaluations which we do, which are time-bound, to really take into account properly this kind of dynamic element of the context. So, from a realist perspective, again, looking at the context mechanism outcome configuration, context is considered to kind of providing the necessary conditions for mechanisms to be triggered by a particular program or intervention. But we also need to take into account context because it shapes the actual implementation of the program. It kind of sets the limits around what is possible within a particular context when you intervene from a program or intervention perspective. And it could also very much be that elements of context are in fact explaining the outcomes you observed, and therefore kind of offer an alternative or perhaps the actual explanation of the outcome. So we need to take a look at context in a very thorough way. Within the field of realist evaluation, guidance and developments, and basically on the methodological guidance, has been going on since the publication of realistic evaluation in 1997. But it remains a big challenge to make sense of context. The guidance which has been developed by Jeff Wong and colleagues, both for realist synthesis and for realist evaluation, offers very pointed and very good kind of guidance to it. And I think it merits always, I mean, it's always good to look at that guidance whenever you're kind of stuck when you carry out realist evaluations or synthesis. And other papers have been written about mechanisms, causal configurations, and about context. Yeah. So if context is going to be really important, what kind of evidence do we need? How do we go about creating knowledge, data, insights when we do realist evaluations? And how do we, in fact, map or understand context? You could say that you can look at kind of comparative evidence. And, you know, as well, looking at the kind of the principles of realist evaluation, there's this notion of cumulative learning, whereby doing research cycles or repeated studies, repeated evaluations of particular programs, it is possible to kind of accumulate slowly and gradually insights into what you're evaluating or researching, because your program theory that you're looking at will get refined ever more by repeated research of the same intervention in different contexts, or of a kind of slightly different intervention in similar contexts, or interventions that target different actors. So variation of context is going to be quite an interesting strategy. Alternative approaches have been developed in political science with Beach and Pearson, and by Bartlett also, either looking at causal case studies, process evaluations, and rather the comparative case study approach by Bartlett. These are just kind of some, let's say, alternatives or other approaches to deal with context from other disciplines. The second aspect, and especially here again looking at the dynamic aspect of context, long-term research and long-term follow-up will be quite essential, because at some point, not only in fact do we need this long-term perspective to look at how outcomes achieved or not on the short term actually can change in nature, in intensity, in coverage over time, but also because what you do at one moment in time with a successful program will change the context, and therefore you see kind of a difference in context when you would do a follow-up study because of your previous intervention. And so there's nothing like snapshot research. There's nothing like evaluations where you just go in and kind of consider a particular program in a particular point of time. Ideally, you should be able to do much more kind of long-term research. I'm not sure if I'm not going to switch yet to Sarah. So another kind of remark pointing to the importance of context is kind of a solution or an alternative approach. What I say a solution is to see in how far we can describe the cases we're looking at much more thickly, much more richly in a way. And in fact, if you look at realist reviews or realist synthesis, realist evaluation papers, realist research papers, despite the attention that is given to context within the guidance, we often still see that context is not sufficiently developed, not sufficiently analyzed, or not sufficiently described. And therefore, there was this call to go to much more dense causal explanations that take into account context much more. And I think here again, the trade-off is between going deep in terms of analysis, trading off with the kind of parsimony you may want to achieve in communicating with policymakers and people who will actually use your research. So it is actually still a challenge to properly deal with context. This is a very well-known graphic, the CMO configuration. Not only us, other people as well. We've all been trying to play around a bit with this kind of heuristic, which is central to the kind of empirical analysis, the analytical phase of realist evaluations or realist research. What we kind of did over the last 10 years probably is to introduce a number of other elements into it. We call it now the ICAMO configuration, whereby we explicitly basically ask people to mention the intervention they're looking at, the program they're looking at, or if it is not an intervention, actually describe the initial situation at one point in time so that we can see how that situation changes and leads to kind of a changed outcome if it's an intervention, because actors, and I think we put actors at the center, of course, because of the agency, the important role of people. It's people who change situations, not policy papers or interventions or, I don't know, the WHO, it's actually people. And so people will do things, will change their behavior because the mechanisms actually trigger them to change their things. And that's a helpful kind of way forward, we feel, but we went further.
What we just saw, the realist approach to context, sort of multiplies questions, methodological questions. How do we define context? What is salient context? How do we identify the key elements we need for causal explanation? Even if you look at very simple and even linear programs, you have a potential wide range of context that you could consider. How do you account for the temporal dimension? And we mentioned time. Context might evolve during the intervention, post-intervention. How do you make sense of different intersecting layers, micro, meso, macro? Which level is most important? What is the influence or what is the interaction between the levels? And of course, what is the interaction between agency and context? Now, Archer, and I will come back to her in a second, also spoke about the risk of downwards and upwards conflation This is wider, of course. It's not only a problem of realist evaluation, but of social sciences in general. But for causal explanation, we might risk at this moment that we sort of choose or prefer to have an explanation almost of the micro over the meso level. In health, we have seen, I think, in the first, let's say the 80s and the 90s, a lot of research focused on individual behavior change, while the relational aspects or interpersonal dynamics or organizational dynamics were largely ignored. It can be also the other way, of course. So here we're speaking about methodological individualism and holism. Now, we were looking at, and this is only one way, of course, Margaret Archer. And Margaret Archer, her body of work, which is enormous. She has published a lot of books, very philosophical works. But she's maybe lesser known in the realist world than Roy Bhaskar. But she's one of the most eminent British sociologists post-World War II, and she was a big forerunner of realist social theory and philosophy. And she's best known for arguing alongside or against Anthony Giddens' conflation of, or she says it's a conflation of his structuration theory, where she argues that structure and agency should be analyzed separately. This is one of the core debates, of course, in social sciences. And she presented her theory of morphogenesis, or the morphogenetic cycle, where social change is continuously emergent and can be causally explained through analyzing the interrelationships between agency on the one hand and structural and cultural conditions on the other. The very nice thing of Margaret Archer is that just before she died, because she died last year, she published in 2020 some practical guidance in the form of an analytical framework to make sense of structure, agency, and culture. And it's called the SAC framework, Structure, Agency, Culture Framework. And this was published fairly, how do you say, it's invisible in a book on agential causation and causal explanation in economics. And she also applied this SAC, yeah, I call it SAC, but maybe it's SAC framework in 2022 to explain differences between educational systems. And this for us, of course, rang a bell, as we are here health systems researchers mostly. And she always said, or she has said at the time, that there is no such thing as contextless action. And in her morphogenetic cycle, she presents structural and cultural conditions which both have causal powers. And it's the interaction for her between structure, culture, and agency, which will trigger causal mechanisms which generate social change, morphogenesis, or not. No change in the end. There's a return to status quo. So you have maybe briefly a moment of upset equilibrium and then a return to status quo. Structure, she understands as material resources, social structure, rule systems, institutions, and the cultural system she understands as the ideational world, discourse, values, beliefs, norms, and so on, how we understand things. We tried to integrate this SAC frame into the realist research cycle because we think that this is a potential way out of the context pitfall, where the SAC will allow you to dissect context into structure and culture. It gives you guidance to distinguish context prior, during, and after an intervention, or to at least consider time and evolving context and evolving interactions. And it also investigates the potential for sustained change after the intervention. And this could be applied in the realist cycle for program theory development, for analysis, and for synthesis.
Okay, so last part of the presentation, where we'll focus now on how this SAC framework actually can be applied in realist analysis. It's based on paper evaluation from last year. And in that paper, we kind of identify 6 steps. So it's kind of guidance or prototype of guidance, if you want, kind of preliminary way of trying to see how the principles of Archer's theory and in fact the SAC framework could be applied in realist thinking. So the first step is to identify the actions or the interventions with the potential for change, and it focuses a lot on the key practices that actors actually carry out or not. The second step is to look at the context of action, and it's also defined the implementation context. So the context, the direct context in which the intervention is actually taking place. But context here is split in context of action, and in the third step, we look at the more kind of meso or the macro elements of structural and cultural conditions that actually frame the intervention and, of course, will play an important role. So I think this is where, at least in the first step, we kind of split the analysis of context by looking at the direct context of action and the more higher level structural and cultural conditions. Then step 4 is about the actors and who exactly is initiating change. That is basically actors who will introduce an intervention, what's their logic, kind of the rationale of doing so, what exactly do they do, and how does that affect the targets, if you want to call it that way, the actors who are supposed to be implementing or the target of or beneficiaries of. These are kind of dirty words. It's basically how people deal with the intervention they are confronted with. And the fifth step is then to look at the causal mechanisms. And finally, in the sixth step, the idea is to look at the potential of the intervention you're looking at to sustain change over longer term. And so not just look at direct outcomes, short-term kind of outcomes or impact, but rather the potential of introducing sustained social change, transformation. That's going to be a hard nut to crack. Now, the paper is applying the framework to a specific study on adolescent accountability situations. What we did is kind of simplify the example by looking at a pay-for-performance scheme. And so pay-for-performance or results-based financing, it has been a quite strong, should I say, tendency, fashion, a trend in global health, whereby donors kind of jumped on pay-for-performance as a way to improve the performance of health services, health programs, or health systems at large. And so what's the idea? The outcome you want to achieve with these schemes, and I think here we could kind of focus on a particular application whereby, for example, health workers working in a first-line health center or hospital are incentivized through the scheme to work harder by tying their salary, their remuneration to their actual performance. So basically, we will call the increasing performance as the outcome. The intervention is summarized as you tie the salary or your remuneration to actual performance. And the way we would see it from the SAC perspective would be to say at least, okay, at the angle of actors in the game here and the practices, because it's not the intervention that changes things, it's people who change practices, and the practices lead to the outcomes you may desire. In the second step, we look at how we can define and describe the context of action. And so context of action can be, in this case, the team in which individual providers or staff members work, the organizational context in which they work, and that includes not only the way their jobs are described, but also how they're being managed, the leadership style that's being used, the initial salaries they are getting, the working conditions, the availability of resources, etc. Now, in the third step, and again, sorry, the actors here, you can then also go deeper into what is their current salary, what is their current state of motivation, what are their own personal expectations, what are actually the needs they're trying to fulfill. So looking both at the kind of characteristics of actors as well as the direct context in which they operate in their day-to-day kind of activities. In the third step, we add the layer of structural and cultural conditions, and that is where we look at, For example, what is the structure of the public service? Who is leading whom? What is the hierarchical relationship between people working in a particular facility, and how does that facility operate in the larger public service? What's the culture of the public service? Are there notions of public service motivation? Is that an important driver, in fact? Is that something managers actually use to steer behavior of people? But also much larger economic situation, what's the political landscape? You can add multiple layers, of course, and elements at this stage. We'll come back to how you make sense of that layer later. In a fourth step, the idea is to look at who is introducing the intervention here. Who are the people who actually steer, manage, fund, introduce intervention in this particular context of action. And that is quite often in the case of pay for performance, project staff, either national staff or technical assistants coming from international agencies. But very often, in fact, in the history of pay for performance schemes and results-based financing at large, it is an outside intervention. It's an intervention that comes from the outside, usually donor countries, and is being introduced, initiated, forced upon, there are different ways of looking at it, upon particular people in particular health systems, and usually in the South. So here that will be important in a sense that you need to understand how these actors look at health, how they look at performance, what their public health ideology is, besides their other kind of political and social orientations. In a fifth step, you remember we said we would look at causal mechanisms. And that is where very typically, again, going back to pay for performance, the mechanism that you hope to trigger if you're a believer of this intervention is that extrinsic motivation. So any kind of motivation that comes from outside the person, and so opposite to intrinsic motivation, that will actually lead to changes in behavior, which of course depends very much on the current salary and the situation in which the people you target are actually working. The sixth way and sixth step, last step, the idea is to look at how these mechanisms function and how long they will function, what exactly they will achieve. And so in a kind of normal way, normal in the sense of typical realist evaluation, we would say, okay, where does performance-based financing work? It works in situations where salaries are low and where kind of presenting people with a financial incentive where you may have a chance that they will consider to change their practices and work harder, work longer, focus on particular targeted interventions, etc. It works therefore for people also, not only people with low salaries or in settings where salaries are low. Typical examples where PBF was kind of pilot was Cambodia 20 years ago, Rwanda at the time where salaries were in fact peanuts. So it works for people with low salaries, but it also potentially works for people for whom extrinsic motivation is important. And we know that in healthcare, that is not always the case. There's a very important part of the health workforce, public service staff reps in general, who are still motivated by public service motivation motives. How long does it work? From, again, a traditional realist perspective, you would say as long as it is financially sustained. So the intervention can only work if it is being implemented. The implementation depends, in this case, very much on external actors, and therefore, when they pull out, it's clear that the intervention usually will not last much longer. The effects will therefore potentially disappear as well. But it also has an effect and a duration, let's say, or sustainability of the effect in function of the expectations of staff. It is known from other research on financial incentives that particular incentives work for a particular time up to the point where people who are exposed to them kind of consider the new situation to be normal, and whereby the tie or the link between the incentive and the attended or the expected performance actually kind of going down. And therefore, very typically, incentives need to be increased on a regular basis to maintain the performance of people. So these are just some examples you can draw from psychology, social science, and other studies that looked at motivation and the impact of PBF. Now, what the SAC wants us to do is go further. It's actually trying to figure out in how far does your intervention, not just during the intervention, change attitudes, perceptions, meanings that people attach to work, to their motivation, but also longer than that, beyond the duration of the intervention. So long-term outcomes, which will require that you do the follow-up of your intervention, not just 1 year, 2 years during the intervention, but also after the intervention. What you will also need to document is in how far the intervention is affecting the action context, the direct situation, working situation in which people are working. We know that crowding out of intrinsic motivation is a known effect, in fact, of financial incentives.
Recording in progress.
Which may actually mean that people with a strong intrinsic motivation suddenly will feel less valued, therefore will lead to crowding out of intrinsic motivation. There are other ways in which the intervention will have paradoxical or perverse effects, gaming, tunnel vision. There are a number of kind of negative effects that quickly happen if the intervention is not super well defined and developed. And then the long-term change, it's already clear that, I mean, just kind of based on logical reasoning, that there is a risk that the organizational culture of the system will change. And now we talk about not only the organizational culture of a hospital or a first-line health center, but also of the national health system will change if suddenly at all levels of the system, basically, performance is tied remuneration and salary skills are tied to salaries. And that will introduce kind of a commercial logic. It may lead to semi-privatized kind of services. And the question is whether you actually want that or not. So, summarizing a bit the whole kind of logic, you start with trying to identify the pre-existing structural and cultural conditions, the context of action as it changes during the intervention during T1. You try to figure out in how far mechanisms which can play out at different levels lead to emergence and changes in actors' practices through agency and interaction between people, how that actually is the link between the program as it is being implemented and the outcomes that you observe, and whether or not you achieve sustained outcomes on the longer term, or you would see a return to status. To conclude, okay, we kind of went relatively quickly through the principles of realist evaluation, but we guessed you would not have been new to realist evaluation. We see that context is indeed getting increased attention for a number of years already now. Realist evaluation, because of its central place it gives to context, is one of the approaches you can use to grapple with context. There is already kind of methodological guidance, but also development to take context better into account. We just presented one strand. It's to be further developed and tested still in the next studies we'll carry out. But we feel basically that the approach that's actually introduced is actually quite a promising pathway. So we'll stop here. I'll stop sharing the screen, and we would really welcome questions.
Thank you so much, Bruno and Sarah, for this wonderful presentation, which shows how Archer's sociological perspective can, I think, really help broaden the perspective of program evaluation, both in terms of the increasing the depth of the analysis of context, but also opening up reopening the question of outcomes, looking at much longer terms outcomes and feedback loops. So this is really fascinating. So now we can take questions from the audience. Don't hesitate to either send questions in the chat or raise your hand if you want to intervene. Someone asks if the PowerPoint can be shared. Yes, I'm assuming we can share it on the website and if needed. Okay, so well, maybe I'll start with questions. Maybe could you specify around what aspects of context the input of this approach is more salient? Like what aspects would you argue other realist approaches would not at all have taken into account, and that this approach can really uncover? Maybe we can take a couple more questions. There's a question in the chat Do you think SAC is specifically applicable to global health? And we have a question by Valérie. Go ahead, Valérie.
Yes, good evening, Bruno and Sarah. Hello, bonjour. Thanks for the presentation. My question is related to the level of context. Do I understand well when you say that context of actions can be the mezzo level, and finally structures and culture is the more macro level, but what you suggested as a context of action is something like organizational context, the context of the organization where the intervention is implemented, or is it something else?
Okay. Shall I start with?
Yeah, maybe we can start.
I'll start with the first question on salient context. I think what Archer and what Realist has shown is that what for me was appealing is that it avoids a bit the risk of downward conflation. There's been a lot of let's say behavioral change interventions in global health at individual levels, influenced, I think, by psychology. And Realist and this attention to context brings to the fore, for people that are mostly looking at patient-provider relationships, let's not forget that there are also some structural or higher level determinants. About the question of Valerie, no, that's not what we mean. The context of action is actually also a concept of Archer's morphogenetic cycle. And it is a sort of delimitation in time of where the intervention works, and the structural and the cultural can also work at macro, meso, micro level. Okay, so it's a bit more, even more complex than that. So it's not that it's the organizational at the context as the context of action. That isn't the case. It's both at the structural and the cultural can be at those levels. Okay.
We need to adapt our figure, because I think the way we present it in the slides also, it kind of seems as if that action context is situated below the macro of the, and that's yeah, we should improve that.
The thing still also, Valerie, about the structure and culture, if you read Archer's works, and that's a bit the challenge of it, of course, is that she explains, for example, in her application of educational systems, she compares, I think, British and Norwegian educational systems. She looks very much at the macro level. She's not really into that individual. So while she claims that it can be applied to SAC also to the other levels, if you're working at the organizational level or the micro level. And so that is a bit the methodological challenge for us, how to adapt this to our kind of work, because it sort of should work because she's looking at educational systems which should align a bit with our view on but for interventions, it needs some translation, but it should align.
Thanks. Estelle, you had a question?
Yeah, thank you. Thank you very much for the presentation. I like the typology, it's kind of practical in some way. My main question has to do with the empirical part. So how you described it was very descriptive in some ways, right? So you collect information on all of these elements of context, depending, on close context, etc. So you can gather information. But how do you go from description to explanation? And that's where I'm struggling a little bit, because perhaps not all elements of context on which you will have information, data actually matter. And how do you know that they do matter? Especially if you're looking at it within one case or one set of intervention. Yeah, thanks for engaging with this topic.
It has to do with focusing or refocusing from the identification of context as a sort of box, a separate box, to looking at the and I know it's not easy, so it's not a miracle solution, but looking at the interrelationships. What you're doing is not collecting data on a list of context features. That is being done. There are a lot of analytical tools in public policy analysis who do context lists, but it is really looking at the relationships. And it's a thinking thing, so it's not so easy to put into something like a tool.
But perhaps one way to kind of respond slightly differently is to say, okay, if you apply the logic of the SAC when you develop the program theory, there's an echo, I think, Fred, yeah, thanks. So if you apply the logic of the SAC when you actually develop or elicit the initial program theory, then that forces you somehow to look into the theoretical background, kind of different explanations that you may see about the intervention that you're looking at and how it interacts with context. So you need to deepen basically your hypothesis, which is the initial program theory, about why this intervention is supposed to work and what kind of context conditions it would require. So that's also kind of reacting to the question on the salient elements of context. So of course you can't map and describe everything. What you need to do is just to identify the key elements of the context that you think are going to be important to explain the outcomes. Now, the initial program theory is a hypothesis, and you test it empirically by collecting data on all of the elements from your initial program theory, including now perhaps a more in-depth analysis of which kind of context elements you need. And that will allow you then to collect data on these elements. Now, does that preclude the possibility that you will see new things or miss things? Of course not. But you have a starting point. You should remember, of course, realist is very much about setting out a hypothesis, testing that hypothesis and refining it, not claiming the universal kind of truth after one round of research.
Or being comprehensive, of course, because it's a sort of learning evaluation idea. You continue learning on what salient context is in a sort of cumulative learning approach.
Yeah, okay. Again, I think we should go much further in this, but are there other questions?
Yeah, on the chat. Yeah.
Yes, so we have a question in the chat. So as a realist evaluator working as an embedded researcher with a provincial health system, do you have advice on how to translate these philosophical concepts to decision and policymakers?
Yeah.
That's an important question indeed.
Yeah, I think what you see is the back analysis. This is not what you present to your policymaker. I've done some global health program evaluations. They are not, of course, interested in this kind of how you do the analysis. So I wouldn't explain this backform analysis. I would only explain and hope that they are interested in that they would like to know what specificities of the context make that in some settings a certain program works and doesn't work in other settings.
Mm-hmm. Yeah, it's about, I think, trying not to explain the whole philosophical foundation, but rather to make them see, okay, how do programs actually work? It's about people. They work sometimes and they sometimes don't. We don't want to know, does it work? But the why is very important. The how is very important. For whom is very important. Okay, it's always claimed that policymakers want that kind of information. In actual fact, they not always want that kind of information. And so it's also kind of an attitude change. I think it's a bit what Jill Westhorp quite successfully did in Australia through long-term engagement with policymakers at different levels. Try to shift that attitude or the perspective on what are interventions and how do you change things.
And it's also a sort of methodology that doesn't, that we don't sell for everything. You use it for certain kind of evaluations, but not for others. You use it to learn, not for accountability. You use it when you have a lot of time, hopefully formative, to explore, not only retrospectively, because also our experience has learned that doesn't often work that well. So it's only for specific things, specific uses. We don't want to oversell it, I think, also.
Thank you. Yes, Reinhard.
Yeah, thank you for this very interesting presentation. I'm a retired public health academic with some experience in international health. And I've got two questions. I mean, especially related to your example of performance-related pay. How do you differentiate between individual and collective agency? For instance, if the performance-related pay is misused as sort of a favoritism and to give certain staff unfair advantages, this can only be changed by staff if they take collective agency, and that is much more difficult than individual agency and just adapt to the circumstances. So that's the first question. The second one is related to what I call historical context. If you as a health professional volunteer to work in a very difficult environment because of the socioeconomic and other conditions, you may actually not achieve much in terms of performance-related pay because every step forward is such an enormous effort. And people who go to an easy environment may sort of do very well on the sort of performance-related pay. And so it may actually cause frustration or actually discourage even people to go to remote, difficult areas, because there you will not achieve anything with this performance-related pay. So that is more what I call the historical context. How do you consider that? Because somebody may work in a certain context where it is easy to achieve sort of improvements and get a sort of big increase in payment, while another one volunteers to go or is forced to go into a difficult context and may even struggle and try to work hard but not achieve much in terms of performance-related pay. Thank you.
No,
Well,
it's an important,
Yeah.
I mean, two important questions in the sense that they are kind of core elements of the PBF kind of debate, if you want. And at the same time, they point also to a methodological challenge, of course, in research. So basically, in terms of the intervention and how PBF was designed, there are lots of perverse effects that are very well known. And so what you referred to in your second question is basically the gaming of the system, whereby clever staff, smart staff will do the kind of things they need to do to achieve the targets which are set out. So you will focus massively on the performance targets that are actually remunerated. And that means that either within a particular health center, you will focus on everything that has an indicator to it and nothing else, because that's the successful way of getting a higher salary, or you will not want to work in situations where the working conditions are insufficient, and whereby you will, despite your massive personal effort, never reach the targets. Now, to be fair, the PBF thing, of course, has been adapted over time, and the kind of modalities of implementing it, where initially it was very much focused on this kind of financial incentive. Of course, in reality, the PBF scheme always included multiple other elements, even if the adherence of PBF kind of really kind of said it is the PBF, the incentive part, that does the trick. No. It was the whole aspect of improving working conditions, providing training, making sure that consumers are available, assuring a lot of other kind of things which they never really put much emphasis on in their papers. So, okay, again, we could go for 1 more hour, but perhaps on the collective and the singular kind of individual agency collective, that too, in fact, has been addressed sometimes by not targeting individual performance, but the performance of a health center, and so a whole team, which of course goes into the collective agency kind of direction, but comes with its own challenges of how to attribute change to the performance of individuals. And so again,
And how we would use then the SAC framework NRE on that, it's exactly for those two are prime examples of why you should use something like SAC, in the sense that the second one, this is quite a semi-universal causal mechanism in low and middle income countries, in high income countries. If you get a bonus at the first time you get this bonus, this might mean a lot for you, but this has diminishing, it's the law of diminishing returns. It will always, the value diminishes each time you get this. So in month 6 or month 7, it doesn't have the same value anymore for you. That's the first, that's why you should look at sustained change after the intervention after some time. And we all know that, but we, sometimes do not have the evaluation designs, nor is there, the setup or the political economy to do this, I think, in development. The other part about individual and collective agency, I'm looking at an accountability in adolescent health, and exactly looking at this interplay. project, sorry, at this interplay between individual and collective agency. And what Archer, I didn't mention it, but she looks at individual agency in terms of reflexivity and the way you develop your thought process. But on the other hand, there's this interaction, of course, with the collective and youth undertaking collective action. Now, if you would apply SAC to that, you would use both individual and collective agency, and those are intersecting. It becomes quite complex, of course, but it depends on what kind of evaluation design or research design at that moment you can look at. But there's definitely a way to factor in collective agency at the meso and the macro level. That's exactly what Archer made, I think, her structure agency framework for, to dissociate between two.
Thank you. We have a question in the chat about interacting mechanisms, and I also wanted to introduce a question on mechanisms, which actually connects to this prior reflection on collective agency. I was interested by your remark, Sarah, about the fact that the general input of the SAC framework is to avoid downward conflation and an excessive focus on strictly individual outcomes or mechanisms. So would you argue that applying such a framework also helps decenter from these individual mechanisms and take into account maybe more collective mechanisms producing outcomes, and collective agency can be one, or, you know, the development of social ties. I mean, things that are not things that just happen in a person's head, but, you know, that sociology describes more broadly. Is that also a possible input beyond the input for context?
Exactly, I think so. For global health, this is very salient. Okay, downwards conflation. Maybe if you're a macro sociologist, you will be grapple with the reverse. No, so it is indeed helping you with looking at those levels and the interactions between those levels. Mm-hmm. So yes.
Yeah, and kind of counters the kind of sometimes dominant focus on kind of atomistic or individual mechanistic kind of thinking, looking at cognitive examples and focusing, or cognitive mechanism, and focusing on the individual as the actor of change, and kind of ignoring the structural causes. Now, where exactly mechanisms are located is a difficult discussion. I think there's no consensus on that, not in realist, not in other disciplines. But okay, Ray Possum would say, let's not write down exactly how we define all of these things. Let's be pragmatic. And I think, yeah, another of his aphorisms is realist is an open school. I think we need to be a bit more specific, and that's where the SAC helps us. It's not just anything is possible.
Okay, thank you very much. Do we have other questions or comments that you may want to share? No? You're okay. Okay, well then, thank you so much for this presentation, and thank you all for attending. So our next METHEVAL seminar will be on April 18th with Anna Manzano. So looking forward to it. Thank you so much. Bye. Sciences Po.